Yeah, Elfrida's we're quite a diverse organisation for our size, so we broadly work with young disabled people, and we do that in different ways. I might come back to that. We work with young disabled people, we provide family support to families facing a range of issues, some linked with disability, but not all. And we also provide advocacy services, and in terms of our advocacy provision, we work with adults with a learning disability, but we also work with young disabled people again. We also work with parents of children with special educational needs. I think it's so much to choose from, really. In my head, I've got this example of something that happened last week. I was actually having a meeting with a funder, a small funder, and a member of staff at Gosha. She came up to my office and she was really keen to speak to me. She said, "Oh, Alexis, I really need to speak to you now." I was thinking, oh, this is probably going to be a safeguarding issue, so I made my excuses to the funder and came out to speak to Gosha. And what it wasn't a safeguarding issue. What it was, Gosha works on our project which helps young disabled people to volunteer, to be volunteers themselves. And she'd been working with a young person, who I call Peter, who'd been volunteering at a co-op, local cooperative store somewhere in Camden. And the store were offering him an interview to get a paid job, or part-time job at the store. And they wanted him to come up that very day, to be interviewed. And Gosha was coming to me because she was saying, "Alexis, is it okay?" And it was really sweet of her asking, because I would have said absolutely, and that's what I did say. She said, "Is it okay, if I get a cab and I go and pick up Peter and we rush up?" Then I said, "No, absolutely fine, go and do it." And the reason I'm using that as an example is because I just think that was so responsive. I think both the fact, and to be fair, Camden funds that project, although the funding's due to end in March, but they fund us to deliver it, and we deliver the volunteering project in a really hands-on way. And it is because we think that young disabled people have a part to play. I don't think that Camden would run that themselves directly. I'm not sure. My suspicion is we do run it more cheaply, but that's not really the point about running it cheaply. It's about the quality of the service. It's about believing in young disabled people contributing through volunteering, but then being able to respond to that opportunity. It's about, because what voluntary organisations have, it's not just the service provision, it's all the links, the connections, the relationships, whether it's the relationship with the co-op, with John Lewis Oxford Street, which also provide work placements, with the little local garden centres. So I think when you're looking at cost and value, all those community connections, and I don't know how you ascribe a monetary cost to them, maybe you can't, but they're all part of the package. I think as well about our family support service, Camden Futures. We lead a consortium of agencies working with families with multiple and complex problems. And again, my staff and the staff from the other organisations we're in partnership with, they're so hands-on. They're doing, my background as a social worker, and they're doing what I used to do as a social worker 10 years ago, 15 years ago, visiting families weekly, accompanying them to new resources, being very hands-on. Yeah, doing the stuff about coordinating meetings and case management and monitoring, doing all that stuff as well, but actually getting involved with those families week to week and day-to-day lives, and linking with those families at a really early stage, which absolutely does produce cost savings, because we know the data's there, that rather than letting these problems escalate to the point of crisis, or where statutory interventions needed or safeguarding interventions needed, providing help when people are first asking for it. Gentleman upstairs, John said, and was saying exactly that. And I think, sorry, I mean, we're having quite an interesting debate at the moment. Would I call it a debate with Camden about the future of that project, because it was funded by the big lottery, is funded by the big lottery up until the end of the financial year again. So Camden haven't actually had to pay for that project, although they've given some financial support. There's the opportunity for us to continue delivering that service with some additional investment from the lottery. And we're saying to Camden, we can actually help bring funding into the borough, but can you match, and I don't mean even equally match, can you also provide something which enables this service to continue? Now, to me, it seems, albeit an imaginative proposition, a really easy argument, because it's bringing in additional resource. There's a huge net benefit to Camden's children and families. I think one of the sad things about this time of austerity is it's cutting down on the imagination that at least some commissioners used to show, and it's, no, we can't spend, cut. But actually, and they're not seeing the bigger picture. If they enable us, if they work with us, and if they work with all the other voluntary organisations who can come up with innovative solutions, we can help bring funding into the borough. We can help carry on providing a service which actually it's their social workers are referring to every single day. This is, and again, I'm struck by I remember that voluntary sector book, voluntary but not amateur. This is a highly qualified, not social work qualified, but highly experienced team of voluntary sector professionals providing a really great service which their frontline workers really appreciate. It's got to be worth the investment, because if that service ends at the end of March, they won't have anyone to refer to, and those problems will only escalate. They're not magically going to stop arising for those families at the end of March. Well, I think my concerns are that the thresholds continue to rise, and the statutory focus is even more solely on crisis or crisis intervention. But as I said, those problems will continue to be there. I think that will mean there's less community cohesion. I think that there will be more children and families who get labelled dysfunctional, whose problems don't escalate to a point where there's not an easy resolution. I think there's such a waste of individuals' potential to contribute, whether that's individual young disabled people or any young people who could play a part if people were helping them to take part in work placements or to take part in accessible learning. I think that contribution will get lost, and without being too apocalyptic, which is a really hard word to say, then I think that will lead to problems down the line, because there'll be a group or cohort of young people who could have participated, achieved, but who will be young adults and then older adults who, with less community connections, perhaps more of a greater sense of frustration, feeling less of a sense of belonging in their own communities. I think, again, just to use another example from Camden Futures, which is, as I say, voluntary sector partnership. It's a mix of skills in that team. Our family support workers, creative therapies from an organisation called Quorum. We've also got a financial inclusion worker from Camden CAB who has done immense work working with our family support workers around addressing both priority debt and non-priority debt, although to be honest, I'm sure for the families it's all priority debt, but what I mean is whether it's a parking ticket or whether it's rent arrears, whether it's payday loans. Now, CAB is already there, all those services, all those organisations are already there, but working together, they've had such a reach and had such an effect on helping families as soon as possible stop those financial problems worsening and worsening. And again, you know, just using that as an example, without that kind of intervention, yeah, those debts will only increase. They impact on people's ability to maintain a roof over their home, a roof over their heads rather, or to provide properly for their children. Impacts on people's physical and emotional well-being and mental health. And you know, so you know, there's potentially a vicious cycle. I think as well, one of the interesting things I notice that without good service provision being funded, I think it actually has a dampening effect on referrals. People, because there are still supportive resources out there, but actually people retreat, people get heads down, people, and I'm talking about workers here, both voluntary and statutory sector, perhaps stop making the connections which could produce a good benefit, good outcomes for the families that they're working with. They just do their one piece of work and they don't get together. They stop exchanging information. We all know that these are difficult times in terms of public sector funding. I just think it's sad if statutory organisations aren't working with the voluntary sector to help find solutions and working with communities as well to help find the best possible response to that climate. Because I think working together, as we've always done in the past, or as we have done in the past, certainly in a borough like Camden, we could come up with some better answers than just saying, no, we can't do that, or we can't stop, you know, we have to stop thinking imaginatively, or we can't make those new partnerships. Work together, you know, we're not going to just come cap in hand. We know the problems that Camden has with having to save 80 million over the next 4 years. But, as I say, we can help bring funding into the borough. It's a bit like funding staff development in the voluntary sector. There are good workers out there. You don't want to throw all that out of the window.